no one has really come up with the real cause, just like no one has come up with the real cause of depression after 30, 40 years of study in the laboratory. But it very similar, the main thinking with respect to seasonal affective disorder is that it has a hereditary base. You can see often the same kind of depression, either just seasonal or non-seasonal depression in the relatives. And that the theory is that it's precipitated oftentimes by the season of the year or by vulnerability to stress, and that somehow the neurochemical hormone serotonin is mostly involved in the cause of this illness. The other possible cause involves sensitivity of light to the retina. Mm-hmm. And in the retina is the melatonin system. Wow. And it's figured or hypothesized that the melatonin system has a defect in its genetic component, and it involves a different type of sensitivity to light. So that's why the main treatment for seasonal affective disorder is called light therapy. The interesting thing in regard to this that supports it is that people in Florida have only about a 1.6% prevalence of seasonal affective disorder with all the light, and the people up north, way up in North Hampshire, have almost a 10 times more frequency of 10% prevalence of affective disorder. So it looks like the light theory is the main theory that is being thought out and worked on, and in fact the main treatments have involved light therapy. As you know, the recommendation is for people that work in the dark all night and wind up having this, or for people that work in dark quarters, or for people that work in areas of the United States in the wintertime get mostly dark, a little light. The moving to Florida is one recommendation, moving to the south, or using a square box light. It's called a light box. But that is the main treatment. Now, when that fails, apparently it fails quite a bit, then Dr. Rosenthal and his colleagues bring in the usual treatments for depression, which are anti-depressants and psychotherapy. And of course, that's where I come in. If I see a patient with seasonal affective disorder, I treat them like every other depression. I treat them with antidepressants.